Hey guys, my name's Tony Maritato. I'm a licensed physical therapist, and I think it's always interesting for you, the viewer, to see what a physical therapist would do when we're dealing with some sort of orthopedic pain or issue. So I've got a history, just to kind of fill you in, I've got a history of lower neck pain right around C7, T1. To give you an example, randomly throughout the year, if I do a lot of overhead activities, when I work out, if I do a lot of overhead pressing, C7T1 will flare up. And the next day to 48 hours, it'll just be miserable. But I know that it's just swollen and inflamed. Another example, I was down at the beach on vacation. I got hit by a wave, hyperextended my neck. I wasn't expecting it. For the next like 5 days, C7 T1 was just miserable for me. So today I woke up, it's bugging me. Now, I'm not going to necessarily self-diagnose, but the purpose of this video was to self-treat. And so the treatment protocol I'm going to use is the ComforTrac cervical traction unit. And the reason why I'm doing this is because I want you guys to know, as a physical therapist, obviously I have access to just about everything. I've got E-stim units, TENS units, I've got other clinicians that can work with me. There's lots of stuff that I can do. But what works for me, what feels best for me on a day like this, I'm on my lunch break. My last patient just walked out the door. I'm gonna lay on here. I'm gonna think about my morning. I'm gonna set myself up. And so the way I would set myself up is I position the supports right under the occipital bone. It's pretty comfortable. I don't use the strap over my head. I definitely don't use the strap for my patients, but I don't use the strap for myself either, because I'm not trying to overpower the tension in the muscles, the connective tissue. What I'm trying to do is create a relaxation effect. And to do that, grab this. What I do is I use the little knob, the dial, the guide, and I pump it up to about 10 pounds of pressure, maybe 12 pounds. And then on the wall right up there, I've got a clock. I'll set that clock for 10 minutes. I'll have a little alarm kind of timer so that I might fall asleep. It's very possible I fall asleep, but I don't want to sleep with the cervical traction device on. I want to wake up, if I do fall asleep, when my 10-minute episode is done. And basically, like my self-treatment protocol for a stiff neck, I did a session in the morning. I'm doing a session today at lunch during my lunch break. I'll do a third session before I leave for the evening. Intermittently, between the day, I'll do 2 or 3 exercises just to maintain circulation, improve the chemistry. When we're dealing with inflammation, inflammation is a chemical problem. If I wanted to take a medication, medication changes my chemistry. I want to change my chemistry with exercise, with nutrition, with sleep, those factors. So in this case, what I'm going to do is I'll do this for 10 minutes. I'll probably do 2 or 3 exercises, light intensity, specifically intended to improve the circulation, change the chemistry locally, reduce the pain, and then I'll repeat that again at the end of the day, maybe one more time before bed. So guys, this is what I do when I wake up with a stiff neck. I would love to hear what you do when you wake up with a stiff neck. And if you have questions or want more information about the device, just post in the comments to this video. I'm happy to answer any questions. I'm happy to share any information or personal experiences that I've had, because this has been an issue I've been dealing with for several years now. And as a therapist, I know how important orthopedic musculoskeletal health is. That's why I prioritize it for myself, and I prioritize it for my patients. Guys, I'm gonna pump this up. I'm gonna relax. I'll catch you on the next video.